So we'll move on now to our last presentation of this networking session. It's titled Mental Health Champions in the Workplace, Options for Implementation. And this is from Clare Pearson. Clare has been working in the community services sector with a focus on suicide prevention and mental health for the last 7 years. After joining OzHelp Tasmania and working in a range of roles, including a workplace trainer, Clare took over Executive Officer in June 2018, successfully negotiating a merger with Lifeline Tasmania, which took place in February 2020. OzHelp Tasmania now operates as a program within Lifeline Tasmania and continues to support the building and construction and other industries with a vision to build resilient workplaces where suicide is not an option. Thank you, Clare.
Thanks so much, Pam, and thank you very much for having us along today. I always really enjoy the Better Work sessions, regardless of what industry the session is focused on, but obviously the construction industry is particularly close to our hearts, so it's great to be learning more about it. It's a tag team today, so I'm really pleased that I've been able to bring my colleague Tracy Groombridge along with me today, who's very much the expert in the topic, more so than me, so I'll be handing over to her shortly. I'm just going to give a very brief history about OzHelp for those who don't know about us, and to talk a little bit about the context of why we're here and what we're covering today, and then I'll hand over to Tracy, who's going to run through some of the key considerations that you might have if you are contemplating implementing a mental health support program in your workplace. So OzHelp was established in 2007 as a not-for-profit organisation that was a collaboration between the construction industry, state and federal government. Our focus was on enhancing the resilience of apprentices and workers in the construction industry while strengthening leadership and support from industry leaders. And that was quite a key approach to attack the problem of poor mental health and high rates of suicide from both ends. So providing young workers with increased understanding of increased life skills and understanding of the challenges that they might face both at work and throughout life in general, but also to assist in skilling workplace leaders to be able to better support both their colleagues and particularly young people in the industry. And that approach worked really well. We get data about, suicide data is certainly one of the sort of leading indicators that we refer to. And in Australia, we rely primarily on the Australian Bureau of Statistics data, which reports on a gender, age and state basis. But industry-specific superannuation funds usually collect cause of death data that can give us a bit more of an insight into specific industries. So over the years, CBUS has given us some information about the causes of death amongst industry workers in Tasmania. So I'm pleased to say that the rates of suicide amongst the industry, according to the CBUS data, has decreased over the years that OzHelp has been around. But unfortunately, I have to say that the general population data suggests that suicide increased in Tasmania during the 2019 year. But as we acknowledged earlier, the causes of those deaths is quite complex and difficult to understand. And hence, as Nicole mentioned, there is now a plethora of people and organisations working hard to try and bring those numbers down and try to help people find the support that they need. So we continue. Demand for general mental health and wellbeing and suicide prevention services has increased dramatically across all industries. So one of the really pleasing changes that's happened in the last 10 years is that mental health is very much part of normal conversation, everyday conversation. It's mentioned a lot in the media. So it's certainly a much bigger feature from a work health and safety perspective in the workplace. So most workplaces now understand that psychological hazards are as important to address as physical ones, which is a really good change. So consequently, we've had experience in a range of different industry settings and sectors in relation to implementing mental health and wellbeing initiatives. So the things that we're going to talk about today, we are tried and tested in the construction industry, but they also work in a range of different settings. So whether your business is small or large, we think that this applies. And yes, earlier this year we merged with Lifeline Tasmania. One of the benefits of that is that we can work in partnerships with other services such as the 13 11 14 National Crisis Line, the 1800 line, which was launched this year in response to COVID, which is a Tasmanian specific service. You don't have to be in crisis to access that service. It's what's called a psychosocial support service, which is a fancy way of saying that if you're lonely or isolated or just need help being referred to a particular service, you can call that 1800 number and get that information, which is great. Okay, so what we've found is there are a range of different initiatives, and it's great that you were able to hear from Nicole earlier about the Blue Hat initiatives. And so anecdotally, I haven't done the kind of research that Helen's done, but anecdotally we find that workplaces tend to take one of these three approaches. So they might already have what I call a traditional contact officer program or system, where you have a network of staff that are trained within the workplace, and it could be, you know, one or two in a small workplace to a larger number for a larger workplace. And typically they might have been trained in, they might have had some bullying and harassment training, they might have had some awareness training in relation to family and domestic violence, they might even sometimes be combined with the first aid officer network, and they're people, nominated individuals that staff can go to ask questions, to get some help, and they, the contact officer will refer them on to the appropriate service, and that might be to HR or to work health and safety or to an external service. And that system is still very much alive and well around the state, and in some instances we've found people adding mental health and wellbeing to the suite of training and support that those contact officers are provided with. Another common option is for people to undertake the mental health first aid training. So Mental Health First Aid Australia is a separate organisation to OzHelp. They have created an evidence-based program. It's a 2-day training course, and people like Tracy are accredited to deliver the mental health first aid course. Once you've done that course, you can become a mental health first aid officer. And then often workplaces look to put a system of mental health first aid officers in place. So it's very similar in concept to the Blue Hat initiative. The aim, of course, of all of these approaches is to reduce stigma, because if the stigma attached to a topic is reduced, people are more likely to feel comfortable to talk about it. And it is important, again, echoing what Nicole said, that people are being encouraged to speak up and be encouraged to speak up early. So as with our physical health, the earlier, if you have a physical niggle or complaint, the earlier you put some attention to that, whether that's just making some lifestyle adjustments of your own or whether it's seeking formal medical help, usually the earlier you do that, the better. And if, I know it's a stereotype, but men typically find it difficult. They're less inclined to talk to each other or to professionals about both their mental health problems or their physical health problems. So it's really important that any of these initiatives encourages a cultural shift so that people feel comfortable to speak up. And then also that people connect to colleagues who can then refer them to the appropriate services. So these contact officers or mental health first aid officers are not necessarily trained counsellors, they're not GPs or psychologists, but they understand what those services offer and can refer people to them. And then thirdly, workplaces sometimes might like to do their own in-house or bespoke initiatives. So they might bring OzHelp in to do a tailored 1 or 2 day training event. Wendy French, who runs Talking About Training, has a range of different courses that she runs, such as the 1-day Company Champions training workshop. And sometimes an organisation will give the scheme its own name. So the Blue Hat Initiative is a very catchy title. On your tables is our booklet, which goes to support our How's It Going initiative, which we hope is a catchy title. Are You OK Day is a catchy title. So you might come up with your own for the workplace, and that might come from your staff. And often if people have come up with the idea themselves, they have a little bit more incentive and buy-in to support the program. So each of them have their own benefits, and considerations that you might have range from, how much time can I afford to spend taking people offline to do training, and so there's a range of different factors to take into account. But there's some key considerations that we would recommend, and at this point I'll hand over to the expert to run through those with you. Thanks.
Thank you. Good afternoon. There's a few familiar faces around that I've seen here today, which is nice. My name's Tracy Groombridge, as Claire mentioned, and I'm a trainer at OzHelp. So some of the key considerations, or some of the things that we've noticed that works when people are implementing a mental health program of sorts. The first one is, who should be a mental health advocate representative in your workplace? It's not always the person that puts up their hand that is the best person for the job. Just like any role in a workplace, it's important that you choose the best person for the job. It might be the quiet achiever, the one person that people actually talk to is the person that might be best trained as a mental health first aider or a blue hat or whatever. But I've come up with 7 criteria for you, and this doesn't come up, so if you want to write it down, write it down. So number 1, someone who has the capacity to attend training and to be a mental health first aider or, a blue hat person. So it's not always the manager, because the manager sometimes doesn't have the capacity. So it's good to get someone who's got the capacity to do that. Number 2, someone who has exceptional active listening skills or someone who can acquire them. So that's really important. And don't underestimate that skill of listening. It is absolutely essential for these types of roles. Number 3, a person who's passionate or at least interested in mental health. Number 4, a person who understands the importance of good boundaries. You want to have someone who understands this well and can operate within those boundaries so that we don't burn them out. A person who people naturally trust. Number 6, a person who has good, positive mental health themselves and good self-care. Because you can't actually help somebody if you're struggling yourself. It's really difficult to do. So someone who knows how to do that well. And number 7, someone who has the capacity to respond to a crisis if it happens. Make sure you have a role description for these people, and I'm not sure, but most of the time if you put a mental health first aid officer in or a blue hat, I'd imagine they would come with some sort of role description on mental health first aid website or whatever. I'm not sure about blue hats, but I'd imagine that would be the case. And for others to understand the parameters of that role. They are not a counsellor, they are a mental health first aid advocate or a representative. So how to select? Just base it on that criteria. Number 2, how many should you have? Well, I guess there's no actual number that says this is how many you should have. But what is important is that if you're a small business, you have at least 1 person, or ideally 2 people. If you're a larger business, you want to have a team of people that you can rotate. So you might want 6 to 12 mental health first aiders, so that you might have 6 for the first year who are on, and then you rotate them out and another 6 comes in the second year, just to avoid burnout and to make sure that you're taking care of those people as well. If you're a smaller business, it might be worth collaborating with another small business and actually sharing your mental health first aiders or your blue hat or your contact officers, as long as they're not competitors, of course. How do we promote the network? So we know that businesses that talk openly about mental health on topics like this reduces the stigma instantly. So we know that when that happens, people are more likely to get help and manage their own mental health at work, and it creates positive outcomes for everyone. Just like your physical mental health, your first aid officers, these people should be visible and accessible in the organisation or the business. So one of the ways that you can do that is, just like your physical first aid officers, you can have a poster with your mental health first aid officers. Or you could, on your intranet somewhere, you can have a description about what the mental health first aid officer does and their photo on the intranet. So it's important to make those people visible as well if you're going to promote it. It's also important to have a discrete area where people can go and talk to the blue hat or the mental health first aider, somewhere where they can go, away from other people and actually have confidentiality as an important factor. The Mental Health First Aid website has the Mental Health First Aid koala, which some workplaces place on the top of people's desks or, on its side offices, that type of thing, to show where the Mental Health First Aid officer is located. What does the ongoing support look like then? We recommend that if you implement a mental health first aid program of some sort, that you at the very least, review it within the 12 months. And that might mean reviewing it in terms of getting together the people that are the mental health first aiders and having a debrief, a facilitated debrief for them, but also reviewing whether or not the system works and what you need to do to tweak it, etc., for the following year. Because those people need to be supported to be able to do that role. And you need to know what sort of pressures and what sort of issues they might be facing, and also what solutions they've come up with, across the year. So that's one part of ongoing support. I think, as a trainer, that it's important to have a minimum of 3 hours of that, or at least one day. Take them out one day of the year and actually review that process. We also recommend that in larger businesses, it's best to have, you can have a mental health first aid coordinator. So if you've got 12 mental health first aiders across your work site or across your business, then it's a really good idea to put someone in to coordinate that in some cases, because that does help things. So that's one suggestion. We recommend at the very least to get a mental health policy. A mentally healthy workplace policy should be in place as well. If you haven't got one of those, have a think about what does that look like for our business. And if you want some templates, there are templates on the Mental Health First Aid website. So you can just download those templates and fill them in. Basically, it makes it easy. Some businesses choose to pay their mental health first aiders an allowance, just like the physical first aiders get paid. So that might be an option for some larger businesses who see the benefit in it. And finally, it is important to keep getting, it's not a one-off process, so it is important to keep growing those people, their knowledge and their information, and also perhaps applying for accreditation yourself as a business. So I know that Mental Health First Aid allows you to apply to be a Mental Health First Aid accredited workplace, and that's the system they have in place. I'm not sure about the blue hats, but you could ask Nicole afterwards if she's got something like that. So those type of accreditations, but also applying for awards, because when you apply for an award, it means that you value mental health in the workplace, and it means that you're starting to chip away at the stigma that Claire was talking about. So awards like the Life Awards are out there, which are really important, and we've had people that have worked with us who have applied for Life Awards both in Tasmania and nationally, and other types of awards that are out there in the community that you can start to apply for. So how can senior leaders support the implementation of a mental health program? The best way that a senior leader can support a mental health program is actually show that they value mental health. And the way that you show you value mental health is to look after yourself and your own mental health as well. So if you're asking people not to work back late, you need to show that you value that in yourself and that you walk the talk, if you like, around that sort of stuff. So that's really important, that senior leaders show that they value it and that they are going to embed it in the culture by doing, basically. And finally, oh, no, we'll go back one, sorry. So finally, to finish off, all I want to say is it's a good idea to think about this stuff because, like Claire said, it is part of legislation and it is important. And we know mentally healthy workplaces deliver so many benefits, from financial benefits through productivity through to worker safety. So we know that that's the case, and it is an important thing to do. So the final recommendation is that you start somewhere and you start to take action and do something in 2021, not 2020, 2021, you take action and you start to implement some sort of program in your workplace. So we can start to see positive change for everyone. So thank you very much. Do you want to just quickly chat about that?
Sorry. Yep, that's right. Just to wrap up what Tracy was saying, is if anybody's got any questions, you're welcome to contact us. You don't have to do any training with us. We're more than happy to just chat and give you advice. The booklet and sticker that's on your table, the booklet is a good one. I always say keep it in your glove box, and it covers a range of common challenges that people face in their life, whether it be stress or addiction, and we've recommended where you can go for help for each of those different issues. So think about it as part of your toolkit that you might draw on if you're chatting to a colleague who's needing some support. It's very difficult to always hold in your mind the range of different services that are available, so you've got the booklet there to grab onto. But please feel free to get in contact with us, and as I said, you don't have to be engaged in any of our programs. We're happy to chat. Thank you.